Here's what you need to know about that canine respiratory disease. My name is Dr. Adam Chrisman, and I'm a veterinarian. Today is November 22nd, 2023, keeping you up to date with what we know so far. Laboratories in at least 4 states are investigating this respiratory illness in dogs. And the symptoms of coughing and lethargy, inappetence, are very similar to that of potentially Bordetella, also known as kennel cough, and canine influenza. I chatted with many of my colleagues from all over the country here in the United States to get a sense of what's going on and what's their take on it. Some of these dogs that have that horrific cough, it can turn into pneumonia. Unfortunately, some dogs did pass away or had to be euthanized due to the severity of their illness. My colleague, Dr. David Needle, senior veterinary pathologist at the University of New Hampshire's Veterinary Diagnostic Laboratory, has been researching this for the past year. And here's a new article that just came out of Dr. Little's lab on the respiratory syndrome that we're talking about from cases that they've seen last year up until now. And what he's finding in his population is likely non-culturable bacterium, not a virus. And these types of bacteria have been minimally studied and not well characterized. He goes on to say that it probably was a spontaneous mutation. And very important here, no evidence of zoonotic potential in these cases. But because this is an emergent disease, we can't rule it out 100%. Zoonotic disease is something you and I can get from animals. He then goes on to say to submit a culture in all cases of respiratory disease prior to starting any therapy. He also mentions minimizing dog-to-dog contact, and it would be years, if anything, for a vaccine to come out. I know that was technical, but you have to understand how these things work. Because currently we have respiratory panels that we can run as veterinarians to check for Bordetella, Mycoplasma, influenza, and other respiratory diseases out there, but not this one. So what do? Control the controllable. Be sure your dogs are vaccinated against Bordetella and canine influenza, especially if you have your dogs that go to doggy daycare, boarding facilities, and grooming. Now, with that being said, it's been recommended to scale that back if you can. And I know it's not easy. Listen, I have wire hair dachshunds that need to get groomed every 6 to 8 weeks. And those of you that are working in the veterinary field and working with animals, remember, we can be a fomite. Fomites are objects or materials that can carry infections such as your scrubs, clothes, or shoes, and transmit it to our own dogs at home. Be sure you remove anything you need before you play and see your own dogs. Now, if you think your dog is experiencing signs of coughing or inappetence and just not themselves, definitely take them to the veterinarian right away to get evaluated and listen to your veterinary team. You might have to wait in the car to bring your dog in. You might be referred to an emergency hospital that can house dogs that need to be isolated from the population. Just like with any of these airborne pathogens and diseases, make sure your facilities have clean airflow and filter maintenance, hand sanitizing stations, and even UV system. I do like what this article talks about from LA County from NBC. And it mentions that new illnesses are being defined as an animal that tests negative for the normal respiratory illnesses, but have at least one of these 3 indicators, either chronic respiratory infection lasted more than 6 weeks, it doesn't respond to antibiotics, chronic pneumonia that's resistant to antibiotics, and or acute pneumonia that quickly becomes severe and leads to severe illness or death. I also chatted today with my friend and colleague, Dr. Steve Kachis, who is the Chief Veterinary Officer at the Oregon Humane Society, and here's what he had to say. You are in Oregon, where there were a lot of noted dogs that had this disease. So what are your thoughts on all this?
It kind of peaked for us over the summer. I want to say July, August timeframe is when we were seeing the most number of cases. We are still seeing a case here and there, but I can tell you from managing a shelter population, and we have 2 locations, and we have about a 12 to 13,000 pet intake process. More than half of those are dogs. This has not popped up in our shelter since this all kind of broke earlier this year.
What are some of the things that you would tell some of the pet owners now? Because we do have the holiday season that's here, and I know sometimes we pet parents tend to panic a little bit.
First and foremost is don't panic. Remind people that there are a ton of all the normal respiratory pathogens that we all see that cause kennel cough. Don't panic and think that my dog is going to die from a respiratory infection if they are showing signs. Isolate the dog in the home and call your vet and get some advice and get them seen. Be sure to follow me and save this video. I'll keep you up to date. I'm fortunate enough to chat with many of the leading veterinary professionals out in the country about this. So as soon as I find out any further information, I'll keep you posted.